Good afternoon. I'm so excited to be here to speak with you today. For those of you who haven't met me yet, I'm Sarah Hopkins, owner and senior physiotherapist here at Hibiscus Neuro Rehab. Just jumping on this afternoon to go through our 6th episode of our Neuroplasticity series. So today we're talking about timing and frequency of intervention. Now, why is this important? Well, it's really important because we know that if you only practice something once, we're not going to acquire it as a new skill. And so when we're participating in rehab programs and trying to make changes within the brain, we need to get the frequency and the intensity of the intervention correct to make changes, as well as timing it appropriately and making sure we're doing the right therapy at the right time. So by this, what do I mean? Well, we know that as soon as we stop getting sensory input into our system, the system is actually going to start degrading. So we're having to time the motor and sensory aspects of rehab and put them together effectively. So making sure we're doing a top-down as well as a top-up approach. As well as that, when we're talking about timing and making sure that rehab is effective, we're thinking about doing a whole task training approach so that we're practicing part training and then we're doing the task as a whole task as well and getting that in at the right frequency of therapy. We know that to make great changes within the brain, the frequency of therapy actually needs to be quite intense. So you may be seeing your therapist for 1 hour a week, but it's actually what you do outside the session and how frequently you're doing your exercises and your therapy program that's going to make the most change. We know that it takes about 15 minutes for a new synapse to start talking to another one, and then it takes at least 10 days for cortical map change to happen. But this is with lots of repetitive, intensive practice because we know that those neurons that fire together wire together, and we really want to get those brain changes through that intensive practice. So it's really important that you're creating new habits as you're doing your rehab program, and making your exercises a really important part of what you're doing so you can actually make those changes. So we're also talking about timing of therapy. Now, we know that post-stroke, the first 3 to 6 months are the most important to make changes, but that you can still be making changes 2+ years after therapy, after your injury. And it's really important that you are still continuing to work at things because you can continue to make those brain changes. Just as important when we're thinking about things like MS or Parkinson's and concussion, that we're thinking early intervention is best, and really getting on to your rehab as soon as possible when you're medically stable is going to make the best changes. But it's never too late to start. It just might be harder once we've got all those compensatory strategies that we have to deal with. So the key message to take away from this today is that timing matters. Thinking about getting whole task practice, both motor and sensory input, so that we're getting that intervention really early so that we're not getting that ongoing degradation of the system if we're not getting that sensory input in there. That we're trying to think about early intervention, and that we're practicing our exercises frequently and intensively, not just in therapy, but outside as well. So this is week 6 in our video series. Next week is week 7, where we're going to be talking about challenging and dual tasking. And that's going to be our 7th and final video in this series. So hopefully you're finding this really helpful. If you have any questions, please do not hesitate to put them in the comments below, or send me an email, sarah@hibiscusneurorehab.co.nz. I really hope this helps, and I look forward to speaking with you again soon.